Welcome to this edition of the First Aid Show. When the EMS arrive, they may still need your help and they may ask you to do certain things to help them, especially if there's only one person arriving first. We asked the paramedic, what sorts of things may the EMS ask you to do to help them?
We always use the resources available to us because the quicker we get things done, the more effective we can treat and look after the person that's ill or injured. I will often ask people to look for things like a prescription or medication. People are creatures of habit, and very commonly they are either in the drawer next to the bed or in the kitchen cupboard by the kettle. So if you know where the medication is, or if the prescription is in the handbag or in the box of pills, please retrieve those and have them to hand. The important thing as well is a prescription has their NHS number, their date of birth, the doctor's surgery. All of those things are really important bits of information. The other thing we might ask people to do is to continue chest compressions while we do a kit dump. We can ask you to secure pets out of the way, because even if they're the most friendly, loving, easygoing pet, when they sense that their owner is unwell, they become distressed and protective. So it's really important just for seamless treatment to make sure that that pet is put into another room. Children or relatives that are finding the situation quite emotional, we will often ask you to look after them, because we don't want to cause harm to the people that are onlookers. So to sit with them, to offer them a cup of tea, to get a clear history, all of these things are really important to make sure that we're providing a good service and doing the best for the patient. The patient wouldn't want to know that their relatives are distressed and upset. If you have time, literally jot down anything that you know about the patient or about the situation on a piece of paper, so that that information can be given. So their age, their date of birth, whether they have an allergy, what has happened, what time the seizure started. Another amazing piece of kit is our mobile phone. So if at any time you have seen a car that they've hit, you can provide a photograph of, where they've hit the car, or you can provide a photograph of the helmet or a photograph of the medication that we can then use as a useful bit of information for our treatment. Some people will record a seizure, particularly if it's your own family member. They will start the film and they will record it, and that way we know when it started and when it finished. And we can show the doctors or the clinicians that are treating the family the nature of the seizure, because sometimes that's quite hard to describe.